If you are over 60 and you take blood pressure medication, what I'm about to tell you could be the most important 18 minutes you spend this month. This isn't theoretical. Strokes from poorly managed blood pressure issues are the #1 cause of permanent disability in Americans over 65, and the warning signs almost always appear weeks before. Most people just don't know what to look for. In my 30 years working with patients over 60, I've seen the same tragic pattern happen again and again. In the next 18 minutes, we are going to cover 3 critical things. First, the real blood pressure number you should actually be aiming for after age 60. And no, it is not 120/80. Second, the exact time of day your pressure peaks into a dangerous zone, which most people have absolutely no idea is happening. And third, a simple 5-minute breathing technique that has been clinically shown to support healthy systolic pressure, potentially lowering it by 8 to 12 points without adding more pills to your organizer. That third one is the most surprising. Stay with me to the end, because if you remember nothing else from our time together today, you will want to remember this one technique. But before I show you the technique, you need to understand why the standard blood pressure guidelines you hear about on the evening news are completely wrong for adults over 60. Let me explain what changed. I know how incredibly frustrating this journey can be. You go to the clinic, a hurried assistant slaps a cold cuff over your sleeve, presses a button, and suddenly you are being handed a prescription for a pill like Amlodipine without anyone explaining why. Perhaps you check your numbers at home and see a 142/88. And your chest tightens with fear because you remember what happened to your parents or a neighbor. You feel like you are walking on a ticking time bomb, left to figure it out all on your own on a Saturday morning. It makes you feel deeply anxious, and that anxiety itself drives the numbers even higher. But it does not have to be this way. Your body is remarkably resilient, and it actually wants to stabilize. It simply requires the proper context. Today, we are going to pull back the curtain on what happens inside aging blood vessels so you can regain total control. Later on, I am going to share a specific study from a major university that turned standard treatment protocols completely on their head. But first, we must address the foundation. Let's start with the most fundamental question. Where did this magic number of 120/80 actually come from? And why is it causing thousands of seniors to be aggressively overmedicated? For decades, the medical establishment treated every adult body as if it were identical. Whether you were a 22-year-old Olympic athlete or a 65-year-old grandmother living in Florida, they wanted the chart to look neat. But as our bodies mature, a perfectly natural biological process occurs. Our blood vessels gradually lose some of their youthful elasticity. They stiffen, much like an old garden hose left out in the afternoon sun. Because the vessel walls are less compliant, the heart has to push just a little bit harder to deliver life-giving oxygen and nutrients to your brain, your kidneys, and your toes. This naturally bumps up the top number, the systolic pressure. When doctors aggressively force that top number down to a youthful 120 using heavy doses of medications, something dangerous can happen. We call it hypoperfusion. Simply put, it means your vital organs lose the pressure they desperately need to receive adequate blood flow. Let me tell you about a patient of mine named Margaret. Margaret is 67 years old and lives just outside of Tampa. She came to see me last year because she was experiencing severe dizzy spells every single time she stood up from her living room sofa. She was terrified she was on the verge of a massive stroke. When I reviewed her records, her previous physician had her on a multi-drug regimen that dragged her blood pressure down to 118/74. On paper, her chart looked absolutely perfect to an insurance company. But in reality, Margaret was miserable. Her brain was starving for oxygen every time she stood up. She was a major fall risk. We carefully adjusted her regimen under close supervision, allowing her body to find its natural equilibrium. 6 weeks later, her reading settled right at 136/82. Her dizziness vanished completely. Her energy returned. She felt like herself again for the first time in 3 long years. She wasn't a ticking time bomb. She was just an aging human whose body required a slightly different pressure gradient to function safely. This isn't just an isolated clinical observation. A landmark clinical trial published in the prestigious New England Journal of Medicine, frequently referred to as the SPRINT trial, as well as subsequent analyses, looked closely at thousands of older adults. While intensive control benefits certain specific high-risk populations, researchers found that for many standard adults over the age of 60, forcing the systolic pressure too low drastically increased the incidence of acute kidney injury and dangerous fainting episodes. Furthermore, a comprehensive European study tracking elderly patients over several years revealed that those with a systolic pressure between 130 and 139 actually demonstrated excellent long-term health outcomes compared to those forced lower. Your body knows what it is doing. If we push the numbers too low, the risk of falls and kidney distress skyrockets. We must aim for a target that balances protection with real vitality. Now that you understand why the standard target number might be wrong for your mature biology, the next critical question we must answer is this: when is your blood pressure actually the most dangerous? Because there is a very specific time of day when the vast majority of cardiovascular events occur, and it is not when you would think. Most people assume their blood pressure spikes when they are stuck in heavy traffic, arguing with an insurance representative, or feeling stressed at a family gathering. But data tells a completely different story. There is a well-documented medical phenomenon known as the morning surge. Between the hours of 4 a.m. and 8 a.m., your body undergoes a profound hormonal shift. It releases a wave of cortisol, adrenaline, and noradrenaline to help wake you up and get you moving for the day. These natural hormones cause your blood vessels to temporarily constrict and your heart rate to increase. For a young adult, this surge is perfectly harmless. But for a 64-year-old woman with slightly stiffened arteries, this sudden early morning spike can push an otherwise normal blood pressure into a highly volatile danger zone. A comprehensive study published in the Journal of the American College of Cardiology demonstrated that an excessive morning blood pressure surge is directly correlated with a significantly higher risk of ischemic stroke in older adults. This explains why so many emergency room admissions for cardiac events happen before breakfast. The tragedy is that most patients check their blood pressure at 2 p.m., sitting quietly in a doctor's office, completely oblivious to the fact that their numbers were dangerously high while they were sleeping or waking up. If you are still watching, this next part is the most important piece of the puzzle. Most people drop off here because they want a quick fix, a magic pill, or a shortcut. But if you stay with me for the next 5 minutes, I am going to show you exactly how to identify this hidden morning pattern in your own home, and how a subtle shift in your routine can mitigate the risk entirely. We need to talk about medication timing. The vast majority of physicians tell their patients to take their blood pressure pills first thing in the morning with breakfast. It is a matter of simple convenience. But think about the mechanics of how drugs work. If you take your pill at 8 a.m., the medication level in your bloodstream is often at its lowest point the following morning at 6 a.m., right when that dangerous morning surge hits its absolute peak. A groundbreaking international research project known as the Hygia chronotherapy trial tracked over 19,000 patients. They discovered something that shocked the mainstream medical community. Patients who took their blood pressure medications at bedtime instead of in the morning cut their risk of cardiovascular death nearly in half. By taking the medication before your head hits the pillow, the drug reaches its peak effectiveness exactly when your body needs it most, shielding you from that hidden early morning vulnerability. Now, please hear me clearly. You must never change the timing of your prescribed medication without discussing it directly with your primary care provider first. Every individual case is unique, and your doctor needs to look at your overall medication profile to ensure safety. But it is an incredibly powerful conversation to have at your next visit. So, we have adjusted our target numbers, and we understand the vital importance of morning timing. This brings us directly to our third point, the big payoff. I am about to show you an extraordinary drug-free tool that you can utilize anywhere at any time to naturally support your system. This next technique is what I consider the single most overlooked asset in modern senior wellness. It is entirely free, requires no equipment, has zero side effects, and works directly with your body's autonomic nervous system to reduce pressure. I am going to show you exactly how to do this on screen in just a moment, so you can practice it along with me. But to truly understand why it works, we have to look at a small, specialized group of receptors in your neck called baroreceptors. Think of baroreceptors as your body's internal thermostat for blood pressure. They constantly sense how hard the blood is pushing through your arteries. If pressure rises, they instantly send a signal to your brain, telling your heart to slow down and your vessels to relax. But as we age, and as chronic stress takes hold, these baroreceptors can become desensitized. They get sluggish. They stop sending the signal, leaving your body stuck in a state of high alert, pouring out unnecessary stress hormones. We can retrain these receptors using a specific clinical protocol known as device-guided slow breathing, or more simply, resonance frequency breathing. A study published in the Journal of Human Hypertension confirmed that slowing your breath down to exactly 6 breaths per minute significantly enhances baroreflex sensitivity. When you slow your breathing to this exact rhythm, it creates a therapeutic resonance between your heart rate and your respiratory pattern. This sends a powerful message to your brainstem. We are safe. We can relax. The brain immediately dials back the sympathetic nervous system, the fight or flight response, and activates the parasympathetic system, causing blood vessels to open naturally. Let me share the story of Robert, a 71-year-old retired school teacher from Jacksonville. Robert came to see me because his systolic pressure was consistently hovering around 154/90. He was already taking 2 different blood pressure medications, and his doctor wanted to add a third. Robert was desperate to avoid another prescription due to the fatigue he was experiencing. He felt trapped. I told him to commit to this specific resonance breathing exercise twice a day for just 5 minutes. He sat in his favorite recliner every morning at 7 a.m. and every evening at 8 p.m., tracking his breath. The first week, nothing major changed. But by week 3, his body began to adapt. His desensitized baroreceptors woke up. After 6 weeks of consistent practice, his average home reading dropped down to 134/80. He bypassed the need for that third medication entirely, and his doctor was able to safely lower the dose of his primary pill. Robert didn't use a miracle drug. He simply utilized the built-in mechanics of his own nervous system. Let's do this together right now. Sit up comfortably in your chair. Let your shoulders drop away from your ears. Unclench your jaw. We are going to inhale deeply through the nose for a count of 4 seconds, and then exhale slowly through pursed lips for a count of 6 seconds. That total 10-second cycle, repeated 30 times, makes up your 5 minutes. Let's try one cycle together. Inhale gently. 2, 3, 4. Now exhale smoothly. 2, 3, 4, 5, 6. Feel that subtle wave of calm settle over your chest. When you practice this, don't force it. Let it flow naturally. This simple pattern is an extraordinary gift you can give your heart every single day. Now that you have this knowledge, here is exactly what I want you to do this week to take actionable control of your health. First, I want you to establish a consistent, accurate home monitoring routine. Do not check your blood pressure the moment you stumble out of bed while your bladder is full, as that can falsely elevate your reading by 10 to 15 points. Instead, wake up, use the restroom, sit quietly in a supportive chair with your feet flat on the floor for 5 full minutes, and then take your reading. Record it in a small notebook. Second, take that logbook to your primary care physician at your next scheduled checkup. Have an open, respectful conversation about your goals. You can say, "Doctor, I've been reading about the morning surge and the Hygia trial. Based on my personal health history, would it be safe for us to try moving my blood pressure medication to bedtime?" Third, incorporate the 4-in, 6-out resonance breathing technique into your daily routine. Set a reminder on your phone or tablet for 5 minutes in the morning and 5 minutes before bed. Treat it as a non-negotiable appointment with your heart. These small, highly practical updates require no drastic lifestyle overhauls, but their compounding impact over time can completely transform your health trajectory. Linda and everyone watching today, your heart has been working tirelessly for you for over 60 years. It is an incredibly sophisticated, beautiful system, and it is absolutely not too late to give it the precise, gentle support it needs to thrive. You have the power to step out of the cycle of fear and confusion and become the active captain of your own health journey. If this detailed breakdown helped bring you some clarity and peace of mind today, you will definitely want to see next week's video. We are going to break down the 3 common breakfast foods that silently interact with common blood pressure medications, causing unexpected spikes before noon. Take care of yourself, keep breathing deeply, and I will see you right here next week.